Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobby Bagley, and I'm the Chief Public Health Official and Director for the City of Nashua's Division of Public Health and Community Services. And I want to welcome Ebram Aziz, who is one of our public health nurses, today as we talk about and bring awareness to our audience on tuberculosis. So the month of March is World TB Awareness, and March 24th is actually World TB Day. So we're going to talk about the importance of tuberculosis, understanding the history of tuberculosis, and why it's a public health issue today of importance. So, Ebram, tell us a little bit about yourself and how you landed with us in public health, and then let's talk about the subject at hand, which is tuberculosis, which we call TB.
Yeah. Hi, Bobby. Thank you for having me, and thank you everybody for watching. My name is Ebram Aziz, a public health nurse at the Nashua Health Department. I started here around a year ago and 3 months now. So it's been my 1 year anniversary, so I'm very excited.
Happy anniversary.
I appreciate it. I started nursing in 2019. From there, I went to corrections and then the emergency department, the operating room, and now I found my passion in public health.
Awesome. Mm-hmm. I like that. You found your passion in public health. Mm-hmm. That's awesome.
Thank you.
All right. So we want to talk about tuberculosis. And so again, every year we try to put out awareness about tuberculosis. For years, we've had a slogan over at the health department of Think TB because it's not very common.
Yep.
And in fact, in our state of New Hampshire, it's a very low incidence infectious disease. However, at the health department, it seems like every year we're at least doing some follow-up of either an active case or of latent TB. So, Ebram, if you can, help our audience understand the difference between active TB, tuberculosis disease, and latent tuberculosis. And then what do we as public health professionals do in either case?
Yeah, absolutely. So like you said, New Hampshire is a low incidence state. We usually get around 12 active cases a year. But there's a big difference between latent and active tuberculosis. So latent tuberculosis is when you've been exposed to the Mycobacterium tuberculosis. Mm-hmm. It goes in your body and then kind of hides because your immune system is keeping it in check, in other words. So at this point, it's not contagious, it's not infectious, and people will not have symptoms during this time. But with latent tuberculosis, it is important to treat, and that's something we want to spread awareness with, because 10% of latent tuberculosis becomes active tuberculosis, and 80% of the active tuberculosis cases have came from the latent population.
Okay.
Latent tuberculosis, like I said, is not transmissible, no signs and symptoms. But with active tuberculosis, there's a few of those. The one we're mostly concerned about is when inside the lung, and that's how it's really transmittable. Because now, when you're talking, coughing, sneezing, the little droplets hang in the air, and while you're walking by or hanging out in a room, you breathe that in, and that's how you get exposed to that tuberculosis bacteria. The signs and symptoms you want to watch out for is night sweats, a cough that's lasted more than 3 weeks and not going away, coughing up blood, unexpected weight loss, and stuff like that. Mm-hmm. So when I was saying tuberculosis is an opportunistic infection, typically when somebody has latent tuberculosis, the immune system keeps it in check.
Right.
If you have been exposed to something that makes your immune system weak, let's say HIV, immunosuppressive therapy, let's say you have an organ transplant, you've been prescribed steroids which make your immune system weak, that becomes active because now the bacteria wants to spread to another host to survive. So that's when you start having these symptoms, and you definitely want to watch out for it. Tuberculosis can also grow in your spine, in your bones, so it's not always the lungs, but the lungs is when we look out for those droplets and it becomes highly infectious.
Yeah. And is it, I've read that the air droplets that the little bacterium can hang out in can be in the air for up to 2 hours.
Correct, yeah.
And I think that's what makes it so transmissible and highly contagious to other people, because we breathe in the air in the spaces that we're in. Yeah. And if you're in a space with a person who's been coughing or talking or even singing,
correct,
that have that bacterium in there floating around on those air droplets, it's very easy for us to inhale those in. Mm-hmm. But you have to be within within a certain amount of space and for a period of time in order for it to really, take a nice little hiding place in the lungs.
Correct, and that's very important. If I'm walking by and somebody have active tuberculosis, most likely I will not catch that. It's typically around 15 minutes within the same contact of the
Okay.
room, and then it's all about the bacterial load. So you want to inhale as much bacteria. Well, you don't want to, but
That's
how
usually what happens.
that's
yeah.
what happens.
Yeah.
Correct.
Okay. And then when you talk about the latent phase, and so it's dormant, so it's asleep.
It's asleep.
So the bacteria stays in the lungs, and the body says that looks strange, and kind of just like grabs it and encapsulates it, and it just stays there. And as long as you're healthy, it won't break down into TB
That's very true.
or active disease, I should say.
Active disease, correct. Your body is forever protecting you. Is while you're sleeping, awake, walking, you have your immune system, a little bunch of soldiers looking out for you, and then it encapsulates that bacteria to make sure it doesn't cause harm. So that's what the body's mechanism does.
Right. And then when we're compromised, immunocompromised, or even under stress, because some
Correct.
people tend to, for some of the cases that I've been aware of and actively investigated, it was more or less stress that actually did it to the person. And under that whole stress response, that little bacteria got out of that capsule and started to show signs and symptoms of folks.
That's a great point you bring up, because a lot of people don't think about it that way. They think, oh, I'm healthy, but if you're living a stressful life and, with the environment, economics going on, it's stressful.
Right.
So that's why we strongly encourage getting latent tuberculosis contained and treated, because we don't want it to turn into an active tuberculosis
Right.
case, because
Yeah.
life hits everybody.
All right. So let's talk about, so you mentioned some of the folks that can be at risk for, TB, especially disease. What are some other categories of individuals that need to know about possible communicability, transmissibility, of the disease, for instance, like travelers? Because, in our country, TB is not like a big disease that we have to worry about until we have cases.
Correct.
But in some countries, it's endemic. And what does that word mean, endemic?
So endemic means pretty much a disease that's kind of very prevalent in the area. If COVID was a pandemic, it means cover the globe. Endemic is for that certain region. So let's say, for instance, we're very blessed in the United States where tuberculosis cases are not very big, but we are having outbreaks every once in a while. But you do travel to a country, we mostly think about where we're going, what beach are we going to see, what restaurant we're going to go. But when you travel to those regions, we also want to keep in mind that what we could bring with us and what we could be exposed to as well. There is a vaccine called the BCG vaccine that is given to endemic regions. I personally come from one of those regions in Egypt, where I was given the BCG vaccine. But unfortunately, that vaccine only covers children only, and up to age 5 years old, and is not really effective throughout your whole life.
Right.
So we want to be mindful of that, be aware if we're sick, be aware when we travel, and when we come back, what symptoms we have discovered now. I came back, now I'm ill. It's very important to get that taken care of and think TB.
Yeah, I know. We definitely want to make sure that we put that out there, to think TB, because it presents just like other respiratory infections, right?
Exactly.
And right now, while we're in cold and flu and RSV season, you talked about a cough.
Yep.
All of those infectious diseases present with a cough. Fever, all of those respiratory infections present with a fever. I think the one that's a little bit different maybe would be probably the loss of weight.
Loss of weight.
Yeah.
Yeah.
Yeah. I mean, you lose your appetite with some of those, but you're not going to lose like 10 pounds.
Correct.
But with tuberculosis, you can lose up to like 10 pounds. You'll see significant weight loss.
Exactly, and that's why it's very important to let your healthcare provider know when you go for those wellness checks and those sick visits. Let them know that you went to a region, because they'll understand if that region was endemic or not. And with TB, most likely it's not TB, but it's very important to rule it out.
Right. Yeah. Okay. So now the significance of talking about this today. So yes, it's TB Awareness Month. We talked about the low incidence of this state, but we actually do have opportunities, or your opportunistic tuberculosis disease. We have had opportunities where we have cases in the state of New Hampshire.
Correct.
Do you want to talk a little bit about that?
Yeah, so there's been a few cases in New Hampshire. The most recent one that I personally worked with was not, so like I said, it has to be inside the lung for it to be contagious. Luckily, this was outside of the lung. So it wasn't contagious, but we managed the patient well, and now he's off.
Where was their tubercle? So the tubercle is actually like the nodule. They
The
call it a
nodule.
tubercle. It's a nodule.
Correct.
So where did that end up landing? Because we've actually had one person had it in their knee.
Yeah.
Believe it or not, we had someone have a nodule on their buttock.
Yeah.
Because it can land anywhere.
Anywhere.
Yeah.
In your spine, literally anywhere. We got very, very lucky with this case. It was actually extra pulmonary, so it was right outside of the lung instead of the inside of the lung.
Yeah. But they're all treated the same way, is that correct?
All treated the same way, and we do direct observation therapy, whereas we manage them. We become their case manager. We help them out with everything throughout. We make sure we collect sputums to make sure that the patient is not contagious. We follow quarantine until we identify how contagious they are or not contagious. And then we make sure that they take the medications, and we help get them those medications if they need financial assistance or seeking medical care.
So now, what is the typical treatment right now? Is it still isoniazid?
Isoniazid, yeah.
Isoniazid.
And rifampin, yep.
Oh, so it's still, okay. Well, you know what? Because those two medications proved to be the most effective.
Correct. And we also, we look at the bacteria to make sure it's not resistant to those strains. And if it is, there's other alternatives as well.
And longer treatment time if
longer
it
treatment
doesn't.
time.
Yeah, so that's really interesting. The science behind this is always extraordinary. Because what they do is they'll test to make sure the bacterium, they'll test, so they do a sputum culture. So talk a little bit about that, right?
Yes.
They collect, how do we know we have TB? What do you do?
So we collect 3 sputum cultures, typically within 2.5 days to 3 days. We make sure that it is a sputum culture, not just saliva. So the person legit has to cough out those sputums. I know it's probably a little graphic for those viewers. But we take that, send it to the lab. The lab will analyze it, analyze the strain of the bacteria, and make sure that, and they run it against certain antibiotics, and that's how they find out if it's resistant or not, or if it's compatible.
Right.
And then we go from there. We work a lot with infectious disease Merrimack. Dr. Granick is a great doctor, and
he was on the show.
Oh, there you go.
Yes.
Yeah, he's a huge help to the city, and then we help manage the patient and make sure that the patient is feeling well and not having any side effects from the from the medications, and 2, that they are taking those medications to protect the public.
Right, and that's directly observed. So we physically
watch the
eyes
patient.
on, making sure that they take it, because if they start the medication and they don't finish it, that's how you can get resistant.
Correct.
Yeah.
Correct. Antibiotic resistance.
Yeah, antibiotic resistance from the bacterium. So now, how quickly does the medication work once a person starts to take it?
So typically it's within 2 weeks. The person is not considered contagious anymore, but we do collect sputums first to make sure that they are not contagious. Yep.
And then in the sputum, they're going to see the bacterial count go down. Is that how we know that it's working?
Correct, yes.
Yeah. Okay. And then what if a person has a side effect to the medication? Then do they get switched off to something else, and do they have to start it all over?
It depends on the regimen. A lot of times we found is if they take it with food, that helps a lot, and also vitamin B12, that helps a lot with the symptoms too as well.
Yeah.
From my experience, I haven't seen much outside of maybe nausea in the first week, but after that, people become accustomed to it.
Yeah, great. Now, and can you also, because there are sometimes women that may be pregnant, can they take isoniazid while they're pregnant and rifampin?
From my understanding, yes, but we'll leave that to Dr. Granick.
And so if a person tests, does the skin test, and we could talk about the 2 different ways that you can test, because there's a gold standard, and they find out that they have been exposed to TB. They may not have active, but they may have the latent, meaning that the bacterium is in their body, and the test picks it up. They can start their treatment. I do know, just from past experience, that some women that are pregnant tend to wait after pregnancy before starting the treatment, but our goal is to make sure that they get the treatment.
Yes.
Yeah.
So in state of New Hampshire, we have 67 reportable disease that we monitor. So if the person gets a blood draw, which is goes to the lab and gets a blood draw, that's usually a quantiferin gold or a T-spot. We get a report on that, and we'll see if the patient has symptoms or not, and that determines if it's latent or active.
Okay.
If it's and there's also a skin test, which is they inject a little antigen underneath the skin, and if it reacts, that means the person has been exposed before to tuberculosis.
Right.
But it also means they could have had a BCG vaccine, and their body recognized that the tuberculosis before. So I personally would prefer the blood test because the one on the skin is very subjective. It has to be measured by a human eye. So it could be some errors to that as well.
Right. So if you did have BCG, so BCG is what's given in countries where it's endemic to children. So adults don't get that in those
Adults don't
countries,
get
right?
it.
Just the kids. And so that can trigger a positive skin test. And then what happens after that? So in either case, whether it's BCG triggered or a positive, what happens after that?
So we look at symptoms and we do a chest x-ray.
Chest x-ray.
Correct. Yep.
Okay. And then a chest x-ray again is looking for
The nodules.
The nodule.
Keyword there, nodules.
Yeah, the nodules in the lungs.
In the lungs, correct.
Yeah, because if it actually went someplace else, it's not going to show up.
It's not going to show, but you could do CAT scans and all that stuff. Yep.
So I'm wondering then, and this just came to me, like if in fact the tuberculosis or the mycobacterium does settle someplace else, it can still trigger a positive skin test no matter where it is in the body.
Correct. Correct. And a lot of times it's discovered accidentally. Let's say a person is having a cyst or a lump, and then they go to the surgery.
Right.
They culture it to figure out what type of pathogen that is, and it finds out it's mycobacterium.
Okay. Oh, yes, we've had some of those cases. And then that whole surgical team
Yes.
then is watched, and they all get their testing done a little while later, and they're observed for a while as well.
Correct.
Right. So again, that's why we want to think TB,
Think
right? We want to
TB.
make sure we have the correct and the proper protective equipment on. So let's talk a little bit about that as well. So when a person presents a certain way, what is the proper personal protective equipment they need to be using?
So if they're in the medical facility, the person would be put on a negative air pressure room, which is with the HEPA filter. I'm not sure if people remember during the COVID days, and also an N95 mask, and that's usually used to protect against the droplet precautions. And then when you go to that level, you're wearing all the appropriate PPE, including gown, gloves, and all that type of stuff. In the home setting, a person would have to quarantine in their home, or if they're on house in a hotel room, where we make sure that they are quarantining until at least 2 weeks of medications, and making sure that they're not contagious.
Yeah. Yeah. So if you're watching again on Public Health Matters, we have Ebram Aziz, who's talking about tuberculosis, because March is Tuberculosis Awareness with an actual day. You know, it's an international highlighted disease that we focus on, because tuberculosis is one of like the top 5 killers.
Correct.
Of infectious diseases.
Yeah.
With malaria, Spanish flu,
Yep,
influenza killed quite a few people. COVID's up in the top 5.
COVID.
It came in at number 5. And the plague was up there as well. But TB is like right up there, number 2.
Yeah, and TB has been around for thousands of years. There's even records where ancient mummies were found with tuberculosis. It was actually discovered in tuberculosis in 1882 by Robert Koch.
Yeah, so Koch was really, so for science back to biology geeks, right? So Koch was really instrumental in finding that bacterium itself. So a lot of times there's something that's called miasma, where people think diseases just come from the air, and he's like, nope, there's actually a little bacteria that caused that.
That caused it.
And was able to identify that mycobacterium.
And that's how you learn how to fight it. If you know what's targeting you, that's how you plan against it.
Exactly. So it is treatable.
It is treatable.
So that's one thing about tuberculosis, is that it is treatable.
Correct.
So we've got the antibiotics that will treat this bacterial infection. Best thing is to go ahead and get tested if you think you've, again, if you're thinking TB and you've traveled and you got this nagging cough that just seems like it won't go away, experiencing weight loss, night sweats, right? And so again, for certain people, night sweats at around a certain age they're normal. Right? But when you've got all these other factors, so you have to think about the other factors at the same time.
Correct.
Think about where you've traveled. And you know what? I think what we also want to encourage our audience to do is, because people have had the opportunity now, you can get from one place to the next place in like 24 hours or less, right?
Yeah.
So just think how quickly you can also bring something back.
Correct.
But, you know, it makes us even pay attention to, like, when you travel, know where you're going, right? And what's there.
Knowledge is power. Do your research.
Yeah. And then there's also, I mean, we have the opportunity, you mentioned Dr. Granick, he's an infectious disease doc, but when you do international travel, you have to go and see, right?
An
The infectious disease nurse or doc to get your vaccines. They don't give us BCG, but you have to get some vaccines when you travel. But that's also a good opportunity to ask about, which countries do have, tuberculosis as an endemic disease, so that you can take precautions when you're out.
Absolutely, and
Yeah.
how to protect yourself and protect
Yeah.
your family. Yep.
And outdoors, when you're outdoors a lot, it does reduce risk. It's when you're in really crowded settings where there's a bigger problem.
Correct. Yeah. So if you're hanging out on the beach or some distance between you and others, it's most likely not going to get it.
Right.
It's usually if in congregated settings, like something that's we looked at for a lot in corrections, because it's congregated settings, nursing homes and stuff like that.
Yeah, schools,
Schools,
boarding schools.
Concerts.
Right, concerts.
Yeah.
We were talking. Don't go in the pit. No. But in places where there's lots of people that are gathered together, and you have to spend, in a certain amount of time in that setting, for those droplets to be able to inhale them to where it does really like take a little seat inside your lungs and
Absolutely.
all. Yeah.
Yes.
So tell us a little bit more about your experience with other infectious diseases, since you've been here at the health department.
Yeah, I truly love this job. The way I look at it, we're the eyes and ears for the city. So let's say you went out to eat, you and your family, and next thing your whole family got sick and have really bad diarrhea. You went to the doctor and get tested. Next thing you know, you found out is salmonella. You'd be getting a phone call from me to figure out where did you get that, because it's very important to protect you for once and figure out where the source was and protect everybody else. So we work very close with the other divisions in our department and our other departments in our division. So we work with environmental. They go and do an inspection on this area. Yep.
Well, you know what? It's really interesting that you mentioned that people go to their doctors. One of the things that we find out is people don't.
Yeah.
Right. And so sometimes we miss those.
Correct.
Right. And again, for any time that you're not feeling well, you do want to meet with your primary care provider and let them know what you're experiencing, what your signs and symptoms are, what your travel history has been, because that's another thing that you could pick up, traveler's diarrhea, that you could pick up when you're traveling. So many things we can pick up when we're traveling, but we want folks on, Public Health Matters. Our goal is to help people understand how your health matters.
Yes.
And how the public can be impacted by your health. And so you want to be keen to what's going on with yourself. And yes, call your PCP, if you're having some health issues or you're showing certain signs and symptoms of something that's just not right with the body, that dis-ease.
Absolutely.
Did you get that?
Yeah, dis-ease, yeah.
Right? So that we can protect the public's health by being aware of what's going on within our own bodies.
Exactly.
Yeah.
Exactly.
Yeah. So now, can we talk a little bit about some other infectious diseases? Because I do believe that you also work in our with Hep C.
Yeah.
Yeah, that's another infectious disease. And so any and all of these diseases, if they're present in the body, will also compromise our immune system.
Yep.
So a bacterium like tuberculosis can just wake up.
Yep. It's opportunistic. So in our department, we have sexual wellness clinics, which we test people for chlamydia, gonorrhea, HIV, hepatitis C, syphilis. And we educate, treat, and monitor as well. Stuff like we're talking about that likes to stay dormant, syphilis is one of them. Syphilis can lay dormant in your body for up to 30 years, maybe even longer. And next thing you know, you're having neurological symptoms where you're going blind, you're having weakness, you can't walk, and next thing you know, it was due to that. And this is something that is treatable, but a lot of people don't test for it because there's a blood draw. So if you went and peed in a cup, you missed out on all these other source sites, and also diseases.
Yeah. Chicken pox is another one of those that lays dormant.
Yeah, chicken pox,
And shingles
it becomes shingles.
It becomes shingles.
So you got chicken pox as a child. Once you get older, it becomes shingles and it follows that nerve route.
Right.
Yeah.
Yeah. But again, these vaccines for some of those can be protective.
Absolutely.
Tuberculosis in the United States, we don't have a vaccine for that, but it is treatable.
It is treatable.
So we don't want people to, again, ignore any signs of symptoms of any of these diseases, especially right now in respiratory season.
Yeah.
You don't want to ignore any of these. We do want people to be aware of the fact that you can call your PCP, rule it out.
Yes.
And we definitely want people to think
Yes.
TB because it is one of these very low incidences things that occur in the United States, and in particular here in New Hampshire. So we do want people to think TB. It's World TB Month.
World TB Month, yes. I think TB, and
Think
it's very,
TB.
very, very important to keep everybody safe
And informed.
and informed.
Right? And so we actually have a campaign that we're doing.
Yes.
So we have posters that have been made that have all the information about TB, a nice Think TB, and then all the signs and symptoms. And so we'll be pushing that out and just spreading the word about this bacterial infection that is treatable so that people can be aware. I mean, as I think about it, school breaks have just occurred.
Yeah.
Some schools are out right now, and when people have the opportunity to, they travel and they go to all these different places, and we want people to be mindful of.
Be mindful.
TB.
Well, if there's a vaccine for a certain thing, definitely take it. Consult with ID doctors, and just remember, health is wealth.
Health is wealth. And we are the ones that are in control of that.
Correct.
Yeah.
That is
And the
100%.
other thing about it, Ebram, is that when we think about health is wealth, when we think about public health, it's all of our responsibility to watch out for each other, to help promote, protect, and preserve the health of not just ourselves, but those in our community as well.
Absolutely. Kind of like with the salmonella case. If you never went to get tested, you probably saved the family
Yeah.
that would have went, and maybe they're immunocompromised, and that could have caused their death.
Right.
So it's
yeah.
very, very important to think about yourself, your family, and who else you're protecting.
Right, in the community.
Correct.
Well, you know what? It's been a pleasure having you on with us today, sharing your knowledge and your information about not just tuberculosis, but about other infectious diseases, but in particular about tuberculosis, because we do want people to be mindful of that infectious disease. You've got to be in close contact with an individual. And then again, our main takeaway for this is if you've got latent TB, we definitely want that to get treated.
Absolutely.
So what would be your last parting words for our viewers today?
Think TB. It is treatable. It is around, but it is not scary if you follow the right things. Trust in the medicine. Trust in science. And if there's something that is vaccine preventable, get your vaccines. They save lives.
They do. All right. Thank you so much, Ebram.
Thank you. I appreciate it.
I'm Bobby Bagley, and I'm reminding you to have a great day today and a better day tomorrow. And I'll see you the next time on Public Health Matters.
Thank you so much. Thank you for having me.